years, conventional wisdom has been that high testosterone levels in men contribute to prostate cancer. And because of that, most doctors advise their patients not to boost their testosterone levels. Dr. Abe Morgentaler, a hormone researcher from Harvard University Medical School, disagrees. Welcome, Dr. Morgentaler. Can I call you Abe?
Of course, Suzanne. Great to be with you.
You too. You know, I read your book, Testosterone for Life. It was the most definitive book on testosterone in men that I had read to that point. And then I interviewed you for my book, Bombshell, this year, and you gave me the bombshell of bombshells, which I think is an absolute game changer. Why is conventional medicine so adverse to giving men testosterone when their levels decline? What's that about?
The big fear that doctors have had with testosterone is, for 7 decades, 70 years, going back to the 1940s, doctors have been afraid that raising testosterone or having a higher testosterone level meant it was bad for prostate cancer. It was going to cause it, or God forbid a guy had some hidden cancer, it was going to grow like crazy.
Where'd this come from?
In the basement of the Harvard Library, I find this article that by the godfather, if you will, of prostate cancer. It was really based on nothing. So this idea that giving testosterone to men, and it's going to be some risky thing for prostate cancer, it's based on
Nothing.
one case, and even then really nothing.
Yeah.
Men get prostate cancer as they get older, and their testosterone levels go down.
Yes.
I'm in practice almost 25 years. I've never seen a case of prostate cancer in a 20-year-old where they have their highest lifetime levels of testosterone. Right. It doesn't make sense. So you know why people have said for years that testosterone is bad for prostate cancer?
I do not.
Because somebody before them said to them, high testosterone caused it. People didn't really recognize that men could have these symptoms that we've touched on of lower testosterone.
Tell them the symptoms.
Sexual symptoms are erections aren't as good. Sex drive is kind of the classic symptom, down in the gutter.
Right.
It may be more difficult to have an orgasm. And some guys feel like the electricity down there is gone, like the sexual thing. The non-sexual symptoms are lack of energy, getting tired, but not just tired, like often the guys feel depleted. Guys say, I take naps now, I never did that before. It can affect mood, so that some guys feel sort of blunted or even down, and mood in another way, which we call irritability. Testosterone for men and bones is like estrogen in women and bones. But if they have low levels of testosterone, osteoporosis means they're at increased risk of fractures.
You did a small but important study determining that men with active prostate cancer benefited from testosterone replacement, correct?
Yeah, I figured what's the difference if a guy has prostate cancer and treated, if he had a normal testosterone to begin with, or if he had a low testosterone, I made him normal. What's the difference?
Right.
It's the same.
Yeah.
And we don't think that the guy with normal testosterone has any special risk. So I started treating guys after radical prostatectomy, the surgery.
That is, they remove
the prostate and the other glands that make some of the fluid.
When you remove the prostate, can you have sex anymore?
About 50% or more of the guys lose their erections. It's bad. I started treating men after the surgery. I started treating men after radiation, and it was all okay. But then the big thing happened was when I had a guy in his 80s, a lawyer with this beautiful shock of white hair, and he came in and he had some problems that sure sounded like testosterone. And we tested him and it was low, but his PSA was high.
How high?
And PSA is the blood test we use to diagnose prostate cancer.
Right.
So normal is below 4.
Right.
And he was at 8, which is fairly high.
Right.
So I said to him, you know, sir, I don't make a habit of doing prostate biopsies of men in their 80s, but you look awfully vigorous. He went to work every day as a lawyer. And he said, you know, I'd like to know. So he did biopsies, and he had cancer, but he had sort of the lower grade stuff that now we tend to watch a little bit. And I'm sitting talking with him, and he says, I don't want the treatment, I just want you to watch me. I say, I agree with that 100%, let's do that. And I figure that's the big issue. I'm ready to leave the room. He says, but doctor, what about that testosterone you talked about? And I said, well, sir, you've got active prostate cancer. We're not even going to treat you. I've never treated anybody like you. He said, you know what? I'm 84 years old.
Yeah.
I'm willing to try it. If you'll give it to me, I'll take it. So you know what happened to him? We started giving him testosterone. I wrote a long note in the chart. He understands the risks. He could die, blah, blah, blah. And his PSA went from the 8s, and we'd repeated it, down to the 7s, down into the 6s, down into the 5s. And at 2 years, he was around 6. And we published on his story. He was the first guy I ever treated who had active prostate cancer sitting there, untreated, and nothing happened to his PSA. In fact, it seemed to go down a bit. So what we published is, together with my colleagues at Baylor, is we published on 13 guys. They all had untreated prostate cancer. They all had low levels of testosterone and were missing it. Mm-hmm. So we treated them.
And does it matter what stage?
They were all localized, early, all of them early. And at the end, with an average of 2.5 years, the longest was 8 years, all with biopsies. PSAs didn't go up, size of the prostate didn't go up, all the men felt better symptomatically, and none of the men had progression of their cancer. Even more interestingly, more than half of the biopsies, 54%, showed no cancer at all.
This is incredible work you're doing, and I feel like I have this obligation to make sure I let as many people know as possible. Dr. Abraham Morgentaler, he has so much to teach. It's been a pleasure.